is always going through that process of pruning away things that are unneeded. It just does a big amount of it at age 2. But yeah, all throughout our life, we can make new connections. We can learn new skills. So yeah, neurons are really interesting in the way that they work that way. I don't want to go too much on a tangent for neurons, but yes, we can definitely make new connections to replace things that have been lost. A good example of this is if you get a brain injury that maybe you get a concussion or something, and a part of your brain cells, maybe like a small portion of your brain cells, actually dies. Let's say it's even large enough to be, or even you have cancer or something. Oh no, it looks like the meeting recording stopped. Huh, but it still says it's recording. Sorry. Let's say you get some sort of brain damage, maybe it's from cancer or something, and so something about the size of the end of your thumb in your brain is now missing. Your brain can actually make new connections to kind of replace those functions that were like done in that area of your brain. So it's easier the younger you are for the brain to do this, but at any point your brain can kind of shift and move responsibility to other neurons that were part of the network for those processes. So you can definitely have that kind of brain plasticity and have that capacity of learning and gaining new skills and making new connections all throughout your life, which is pretty neat. So hopefully that answers your question and maybe even a little bit more. It's one of my favorite topics, looking at how neurons connect up and talk to each other. So jumping back to the prenatal, oh, go for it. I see another comment here.
So with that part of your brain shutting off after 2 years old, and then you brought up like people that are in comas. So when they wake up from the comas, they're fluent in like a language that they never knew before. So how does that work?
That's a really good question. I would need to see a study on it. I haven't ever actually looked at one. So maybe looking for a good study on that, maybe a case study on someone who that happened to, would be the best way to answer that. Because I cannot imagine from the way neurons are that a person in a coma could just learn a new language without having exposure to it. So if they were, say, in a different hospital where people were speaking that language, they could learn it without being cognizant of learning it. But knowing a completely different language that they'd never heard before, I think I'd need to see a study about how that process was done. Um, with that being said, I've mentioned question papers a couple times today. I wasn't going to actually talk about question papers yet, but maybe I should, as I'm mentioning it so many times. I'll do that at the beginning of next class since we're so close to the end of class today. But yeah, really good question. So sorry I don't know. I wouldn't expect it would be the same process as learning a language normally, but yeah, I'm not sure about that. Really good question. I'll actually write it down to look it up and see if I can find a study on it. All right. So infertility is defined in your book about a lot more people than I think people generally realize because it's not talked a lot about, at least in the US. About 10 to 15% of couples do experience infertility. And so that's the inability to have a child after 12 months of regular intercourse with no conception or contraception, sorry. So with that, this can be caused by quite a few things. Some are a lot easier to treat and some are very difficult to treat. So not ovulating, that one can be pretty easy to treat. But then abnormal ova or blocked fallopian tubes, implantation problems, so that would be the fertilized egg implanting properly. Too few sperm that can't move adequately, or sperm being blocked. All of these things can cause infertility. And some of the symptoms of each of these look very similar. So going to a doctor and figuring out exactly what it is, generally a doctor will try some of the easiest treatments first, and if that fixes it, awesome. but that's kind of the process, is diagnosing it by treating the easier ones or the more common ones and then narrowing it down to this is what it actually is for you specifically. So with that, surgery and hormone therapies can be effective. We had infertility troubles with our first child, and it was hormone therapies that were effective and pretty quick for us, but my sister-in-law had to do in vitro fertilization for infertility problems. So it just depends on what exactly is happening to lead to the infertility. So teratogens, we mentioned this a couple times. It's essentially any anything that can cause a birth defect or negatively alter the cognitive or behavioral outcomes of a child as they're developing in the embryonic stage. Often the embryonic stage, it can be the fetal stage as well though. So the dose of, usually it's a chemical, so the dose of the chemical, if it's bigger or larger, sometimes there's like a value of, if it's under this amount, it's probably not going to cause problems, but it's over this amount, it's probably going to cause problems. So dose as well as genetic susceptibility. So is that individual embryo or fetus, is it susceptible to this teratogen or this chemical? And then what time is it in the developmental period? Because if it's exposed to certain chemicals early on, it won't have any effect, versus if it's exposed to that later on, it might have a really big effect. So teratogens can lead to things. A good example of a teratogen is alcohol. So fetal alcohol syndrome disorders are caused by the teratogen of alcohol. And some of the things that you can see visually oftentimes are facial deformities. There might be defective limbs or faces or hearts. Oftentimes there's learning problems and intellectual disabilities because of the physical structures of the brain that are working differently or placed differently based on this teratogens. So 1 to 2 servings of beer or wine just a few days a week can cause problems. So definitely don't use alcohol. We're not going to go into detail for each of these, but yeah, for most of these, if you're pregnant, don't use essentially any of these chemicals that we're going to talk about. The caffeine is one that no, not are all the disorders caused by teratogens on a spectrum? Oh, you mean like some people can have that specific disorder worse versus not as bad? Okay, I believe so. I believe each of these, so fetal alcohol syndrome, for example, you could have very little impact. So maybe the pregnant person only had a very low amount of alcohol that affected the fetus versus someone who drank the entire time they were pregnant will lead to a lot more of these possible problems. So yes, pretty much all of these, as far as I know, I might be wrong. There might be 1 or 2 that aren't on a spectrum, but I believe each of them are on a spectrum. So you could have, based on the dosage or the time, less effects versus more effects. So really good question though. So caffeine, there's not a lot of research on caffeine, but the U.S. Food and Drug Administration also still recommends sparing or no use while pregnant. There are other stimulants that you could use during that time, so to wake up or if it's your normal routine. So there's other things that you can use. Just talk to your doctor and they can recommend some alternatives. Nicotine is another one. It increases the risks of SIDS, low birth weight, and fetal and neonatal death. So a lot of possible bad outcomes from nicotine. Cocaine as well can impact a lot of brain development and motor function in a fetus. Oftentimes the infant can be born with an addiction to it as well, which can be really hard because of weaning or cold turkey getting off the drug can be really difficult. So marijuana is a medicine that's being used a lot more. Medicinal use of it is in a lot of states now. So with that, it is related to low birth weight, likelihood of needing a NICU, stillbirth, and lower intelligence in children when used by a pregnant person. So just similar to other medicines, during pregnancy, a doctor can recommend alternatives that are more safe, that can still treat what the marijuana or the THC is being used for. So whether it's being used recreationally or medicinally, definitely talk to a doctor so you can find safe alternatives for a developing fetus. Heroin, very similar to cocaine in a lot of ways, and opioids as well. So again, we're not going to go into detail on all of these. I do hope you read over them in the book. With the time that we have, though, I'm not going to go into a ton of detail. Maternal diet is another one that can be really important. Some of the main needs that aren't often got by a pregnant person are folic acid, omega-3 fatty acids, proteins, vitamins, and minerals like iron that an adult human doesn't need in the same levels as a pregnant person. So prenatal vitamins often have a very close to appropriate level of those. So taking supplements, eating healthy foods is very important while pregnant to help keep the environment for the developing embryo and then fetus in a good place for average development. So maternal age is also a potential risk factor. So this will be the last thing we talk about today. So there's 2 time periods that are higher risk for, or maybe we'll talk about this next time because I did just see my clock turn. So we'll come back to this. We'll finish up chapter 2. There's not too much, and then we'll jump into chapter 3 next time. So don't forget that you do have your chapter 2 smart book due this evening, and we'll finish up the lecture on chapter 2 the very beginning of next time. We might talk about question papers as well, since I keep bringing them up. And then we'll go through chapter 3 smart book as well. If it seems like we're getting a little too far behind, I may even like change the due date for smart book chapter 3 to later, but I figure over the weekend you've got enough time to read hopefully a chapter in the book. But definitely put in the chat any other questions you have. Thanks for being here today. I know it's a lot of stuff to cover in each of these chapters, trying to talk about all of human development in different phases. But thanks very much for being here, and thanks for your questions and participation. I think it was a really good class, especially with the back and forth that we had. Have a good day.